From GC 90.7's Studio A on the campus of Gulf Coast State College, RAPLINE with Emily Balazs.
A group of local doctors are volunteering their time to help the underinsured and uninsured here in our area. Today we're going to be focusing on the Avicenna Free Clinic in Panama City. Joining me today are Dr. Ayman Aboulela, Medical Director of the Avicenna Free Clinic. Also with us is Dr. Heather Shaffer. She practices family medicine, also a volunteer at the clinic. And RAPLINE is a service of Gulf Coast State College and GC 90.7 FM. Welcome both to the show.
Thank you for having us. Thank you.
Yeah, it's great to have you in here. So some people may not know that there is a free medical clinic in town, and it's the Avicenna Free Clinic. What can you tell me about that?
3 years ago, there's only one free clinic in Bay County, which is San Andrews Clinic. And we came up with the idea because we are, health professional, and we know for a fact there's a lot of patients here in Bay County is uninsured. And if you look to the numbers, about 20% of the Bay County residents have no medical insurance whatsoever. So we came up with the idea with having the clinic, and since we opened now since 2011, we been seeing increasing number of patients. We having now probably 1,200 chart of uninsured patients.
And so about 20% of Bay County residents with no health insurance at all. What type of ailments are they coming to the clinic with?
Most of them is chronic medical disease, which we focus on prevention mainly as a primary care. So we focus only on education as well. Many of these patients having hypertension, having diabetes, but they have no access to the medical doctor or any health service. So they end up having a lot of complications like stroke, like heart attack. So in the clinic, we focus on the chronic disease to prevent all these complications from happening in the future.
And so take, for instance, diabetes. I know I've spoken with people from the health department that say that's a big issue. How can you help someone that has a condition such as diabetes?
First of all, we treat diabetes. We are focused on treatment, first of all, so we provide them free medications as well. We have prescription assistance programs. So someone who doesn't afford the medications, we offer him this medication for free. The most important part for diabetes is the education. So, the health department, we work along with the health department to educate the people about their disease and how they manage it and how they control it.
Are there people with diabetes that have a lack of education, that don't really know how to manage their disease?
Most of them, especially the uninsured, yes. These don't have any access to any kind of education. So, and the most important part of diabetes is education. So this is what we've been doing in the clinic.
And so you started just a few years ago, and tell me about the volume of patients that are coming in.
I mean, as any business, we start with slow, and then now end up having 1,200 patients. Just to give you numbers that we have last year, 2013, we had probably more than 16,000 visits. 438 volunteer hours, and 29 physicians volunteering in the clinic. As far as a specialty, we have a different specialty like neurology, which is the only free clinic offer neurology services. A new specialty also, rheumatology, we just started a few months ago. So we not only focus on primary care, we try also to establish specialty clinics in the Avicenna clinic.
And you said you have 29 physicians that are volunteering their time.
Right.
So I know you guys have a day job and your own practice probably. So how do you manage your day job and then volunteering?
We open twice a week after hours for the one who volunteer. Monday and Wednesday from 6 to 8. And neurology clinic from 3 to 5 on Friday.
Okay.
So after we finish the work, and again, it's 29 physicians, so we probably volunteer once or twice a month maximum. So.
And along with physicians, are there like support staff that are volunteering as well?
Yeah, as I mentioned, 438 hours of volunteer hours being done in the clinic last year. So we have full-time staff, receptionist. We just had nurse practitioner for the last year, as certified nurse assistant, plus the volunteers.
And so as we're talking about the Avicenna Free Clinic, people are going to say, okay, where is this located and how can I get services?
The Avicenna Clinic located in Lincoln Plaza in the 15 and Jinx Avenue, next door to WOW, And to be qualified to be seen, we have to see the receptionist, to get a financial screening, because we only accept the patient who have under 200% of poverty line. So, and after they get qualified, get accepted, so they can see the patient after that.
Okay, you are listening and watching RAPLINE here on GCTV and listening to GC 90.7 FM. And we're talking with physicians who are working and volunteering their time at the Avicenna Free Clinic here in Panama City. Also with us today is Dr. Heather Shaffer. And tell me about what you're working on at the Avicenna Free Clinic.
Well, right now we're working on starting a breastfeeding clinic at the Avicenna Clinic. And the purpose of that is to have a place where underserved women who are lactating can come if they need help.
So why is having a breastfeeding clinic important?
It's surprising, I think, to people that have never tried to breastfeed how many difficulties can arise. It seems like it should be a natural process and just happen sort of automatically, but that's not the case, especially in this day and age when we have so many things working against women who are trying to breastfeed. Women face our culture of go, 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 having to get back to work quickly, not having, a long maternity leave. And that's just one of many things that women face. So as women who are trying to breastfeed run into problems, there needs to be a support system for them. And that's what we're trying to augment here in this town.
And so what are some of the health benefits to breastfeeding?
Oh, there's so many. There's so many health benefits to the babies and the mothers.
And the moms.
Yes. There's a lot of good research indicating decreased risk for ear infections of the baby, gastroenteritis, so diarrheal type infections, decreasing the chance for diabetes in children.
Kidding.
Yes, and obesity. Yes, so that's just a few of the many benefits to the baby. The mother gets benefits as well. More quick loss of her weight that she gained during her pregnancy, and decreased risk for ovarian and breast cancer.
And so in general, what do you recommend length of time to breastfeed?
So the American Academy of Pediatrics is recommending 6 months exclusive breastfeeding. Now that shocks people too, because most people think they're going to add either soft foods or something before then, but no, 6 months completely just breastfeeding is what's recommended.
And how much time, a new mom that's never breastfed, has no information on this, how much time is a new mom going to have to devote to breastfeeding?
A lot of time. And I think that's part of what we as medical professionals who are interested in this topic need to change, is the expectations, in the society, the expectations of the mother, and also of the mother on herself. I mean, I'm a working mom. I've got 3 kids, and I feel the pressures of having to keep the house just right, and the dinner on the table, and the kids looking good, and doing well on their homework. And, that's without my, outside job. But the inside job is a bigger job than the outside job. And I think that, we have to change kind of our expectations of ourselves sometimes, and think about the idea that when we have a baby, everything else kind of stops for a while. And we focus on that, and it's really hard to do.
So, Dr. Shaffer, what are some of the most immediate challenges for a new mom just trying to learn to breastfeed? What are some of the obstacles she might face?
I think initially, most often, women are worried about their milk supply. And the milk supply doesn't come in for several days. So that's a little bit of a stressful period. You're not sure if your baby's getting enough. You need a lot of reassurance, and you need stick-to-itiveness and that kind of a thing. Then there's pain, breast pain that can happen, nipple pain, if the baby's not latching correctly. I would say those are the two biggest concerns that women have.
And so once you're getting some coaching, some advice on how to actually breastfeed and how to position the baby and that sort of thing, about how long does it take the baby to learn how to do that?
It's different for every baby and every mother. Yes, it really is. I've talked to a lot of women over the years, and it's very variable. Some women are struggling for months to get things just right, and other women it's days.
So now you mentioned the variance in milk supply. So if that's happening, how can mom make sure that baby's getting nutrients that it needs?
In the very first time frame, in the very first day, 2 or 3 days, she just needs to nurse often. She needs to have a baby close to her and nurse often. If she does that, it's very rare for the baby not to get enough, not to get what the baby needs.
And so going back to work, mom has to go back to work. How does she continue to do that breastfeeding for 6 months?
Yeah, that's really tough. A lot of workplaces aren't set up for it. A lot of jobs make it difficult. Just the nature of the job makes it difficult to take time every couple of hours to pump. But pumping is the way that people do it. And there's a lot of nuances to pumping to get that right too. So having the help of a lactation consultant can really benefit through the entire process from the beginning to the end.
And so what would you say to employers out there who maybe are having an employee who's coming back and is going to need to be pumping?
They're going to need a space, a dedicated space where they can feel comfortable, where they have a lock on the door, and then they're going to need time. Those are the two things they need, the space and the time to do it.
About how long does that take to go in there and pump the milk?
I would say an average of maybe 15 minutes.
So not that long?
Not that long.
And then you put it in the fridge, take it home?
Yes, that's what you do.
Okay. And so what's your advice for those who are kind of on the fence about breastfeeding? They just haven't made up their mind.
The benefits go on and on. The list goes on and on. It does take a lot of determination on the mother's part. It really does. But it's worth it.
And so we've been talking about the moms, but what advice do you have for the dads? How can they be supportive?
Actually, dads and others. Anyone who is there to support the mother is a benefit. And that means that the mom's not going to be able to necessarily get every household chore that she planned on getting done that day done. That baby comes first. Nursing comes first. So any type of support whatsoever, whether it be housework, whether it be childcare of the other children, is very important.
And you are listening and watching RAPLINE here on GCTV as well as GC 90.7 FM. And my guests are Dr. Heather Shaffer, family practice, also a volunteer at the Avicenna Free Clinic. Also with us, Dr. Ayman Aboulela, and he is the medical director of the clinic, talking about their breastfeeding venture at the clinic as well. Just from a personal standpoint, how has volunteering and working with the community at the clinic, how has that impacted both of you as physicians?
For me, I feel more happier when I see, when I serve people without insurance. I feel this impact from the patient, and I get a lot of, thanking from them. And as far as the community, everyone should pay back to the community. Everyone should, do his role to pay the community, because not everyone. There's many patients, unfortunately, they don't have any access to the health service. So this is our part to help them. So I think I really enjoy it. So,
Dr. Shaffer?
It's an absolute joy. The looks on the patients' faces when they get the simplest services are just so wonderful to see. And like Dr. Aboulela said, they voice their thanks so often, and it's an absolute joy for me to be able to provide this service.
And so in general, again, how much money does it take to run the clinics in general?
I mean, we're talking our budget about 50,000. This before the nurse practitioner. We hired nurse practitioner last year, so we applied for the grant, and now we're talking about at least 100 to 120,000 a year to cover the salaries, the overhead, and the rent and all the expenses.
And you said you recently received a grant locally?
We just received a grant. I'd like you to take a chance to thank again Bay Foundation for supporting the clinic, and also Bay Medical Center. We got 100,000 to this year. This is the second year in a row we got a grant, so we're very excited.
And so, you mentioned at the beginning of the show that about 20% of Bay County residents are uninsured without any insurance. What kind of impact do you think the Affordable Health Care Act is going to have on those patients or on your clinic?
I mean, if you look to the numbers, 30% means 20% means like 30,000 people without insurance. The Affordable Care Act might help, get some insured people to have health insurance. However, if you look to the numbers in 2019, it's still about almost 20 million Americans still uninsured by 2019. Regardless, we have the Affordable Care Act. So we still need a free clinic, and still this kind of a free service to the community.
And I know that you often sponsor different talks in the area, and you have one coming up at the college soon.
Since we open also, we focus on the awareness and education of the community. So we had maybe 3 or 4 programs with the Gulf Coast College. I remember when the swine flu was a hot topic at that time, we had a seminar in the IOI, Islamic Understanding Institute. Last year we had a very good seminar about the mental health for the teenager, and we invited psychologists, psychiatrists, pediatricians. So we discussed it from different perspectives, and was very successful program. According to Dr. Shaffer said, the lactation need to focus on also education awareness. Very important to aware the community with the importance of lactation. So we're planning to start the clinic, as she said, and also we're planning to have a program, seminar on the Gulf Coast, and we will invite Dr. Shaffer and one of the lactation consultants to talk about this program.
And you just touched on the flu, and of course we're kind of in the midst of the flu and that sort of thing. How, people say you can die from the flu and to get your flu shot. So how big of a deal is the flu?
I mean, it depends. And I saw many patients end up having bad pneumonia. I saw young patient died. But the flu is a big issue, So I recommend everyone, especially the one who has a chronic medical problems or immunocompromised, I recommend everyone to take the flu shot. So, but again, most of the patients, they can have the flu and nothing happened to them. But still, I don't take a chance with that. So I recommend my patients to have a flu shot.
And so why do doctors always say when you get the flu to make sure and drink your fluids? What's the importance of that?
One thing is you have increased mucus production, and that is fluid, and you need to replace that in your body. Flu is most often accompanied by dry cough, but you have a lot of rhinorrhea, a lot of runny noses. So you need to replace your fluids for that reason.
And so if we're not replacing fluids, can it become a dangerous situation?
Not usually. Again, like Dr. Aboulela was saying, usually if you're young and otherwise healthy, you'll be okay. But if you're older and you have other chronic medical problems, things can get more serious much more quickly.
And as we're talking about fluids, of course, we are getting into the summer season is upon us and super hot temperatures here in Florida. What kind of advice do you have for people who are out and about in the sun all the time?
Stay inside, which is very difficult to do. And of course, drink a lot of fluids, yeah. And again, when I
Wear
talk
your
about
sunscreen.
right, exactly. When I talk about the fluids, I talk about the water, which is the most healthy fluids. Many patients, they think soft drinks is kind of fluids, but actually this causing dehydration more than hydration. So I focus more on the water, or other juices would be good fluids.
And what kind of role do you both feel natural medicine or herbs and that kind of thing, what do you feel about that as far as what role that can play in someone's overall health?
I think that there's a reason that herbal medicine, some of them have been around a very long time and have been used for a very long time. Some of them really work. The issue that we have is that herbals are not regulated by the FDA. So you never know, what concentrations you're getting from pill to pill or from bottle to bottle, etc. However, if they were regulated by the FDA, they'd be a lot more expensive. So you've got that, that push and that pull there. I think that herbals can be beneficial and can be used to help people in certain circumstances.
And so you're just a few years into the running of the Avicenna Free Clinic. Where do you hope to see the clinic in the next 5 or 10 years?
We added another exam room this year, so we have 3 exam rooms. I'd like to have, the clinic to grow more, seeing more patients, and my vision to have a bigger place and more specialty to help, the uninsured people. So I wish we can move to the, bigger building and we have our own place. So.
And again, you're in the Lincoln Center there off of 15th.
Right.
Okay. And your thoughts about the future of the clinic?
I'm really excited about the breastfeeding clinic. There's a lot of good resources available in Panama City already to help someone who's having trouble with lactation. There's at the Bay County Health Department, there's WIC, and Sandy McCrone is a lactation consultant there, a certified lactation consultant, that can help patients. Now, those patients do have to meet certain income criteria, but they can call the Bay County Health Department to find out if they meet those criteria. And then there's Healthy Start, and that's Cheryl Rappel. She's a lactation consultant that works through Healthy Start, and there's actually not any income criteria for Healthy Start, and people aren't aware of that, so they can contact the Bay County Health Department to find out more about that as well. There are great lactation consultants at both hospitals, Bay Medical Sacred Heart and Gulf Coast Hospital. So if you have your baby in Bay County, you have that resource available to you. And then a couple of the OBGYN offices actually employ lactation consultants. I know that Emerald Coast OBGYN does, and I think All About Women, I'm not sure. So there are resources out there, but I'm working with the Breastfeeding Task Force, the Bay County Breastfeeding Task Force, and what we're trying to do is to promote these services and get more and more women to use these services who need them. And as that demand rises, I think that the Avicenna clinic is going to have more and more of a role. And we also have the added advantage of having a physician there, myself, that can deal with breast problems that are more medical in nature or can't be really addressed by a lactation consultant.
Okay, and just some of your final thoughts as far as maybe what have you learned in your 3 years with the clinic that maybe was surprising to you once you got into working with the clinic?
I mean, I learned that everyone shouldn't focus on himself only. We have to look outside the box and see the community around you and see what the needs is and try the best you can to help. So I thank God for helping me for doing this service, And it was, small dream in the beginning, and it was very hard. And the difficult part is to, implement your dream. And the most difficult part is to maintain it.
To maintain it.
Right. So we'll try the best with help with other, professionals.
And Dr. Shaffer?
What was the question?
Just what are some of, the more surprising things that you've learned since you've been working with the clinic?
Well, I had the opportunity to work in a free clinic going back as far as pre-med. So through pre-med and then medical school and residency, and then now I've had opportunities to work in free clinics. And I always, I get more out of it than I give, I can tell you that. So.
And again, location and times of operation if someone wants to stop by?
8 to 5 every day. And we, the volunteer physician from 6 to 8 Monday, Wednesday. Neurology clinic 3 to 5 on Friday.
Okay. And any final thoughts before we wrap up?
I think I'd like everyone to come to visit the clinic and see what service we offer to the community. And I invite everyone to attend the seminar about the lactation program at the end of April at the Gulf Coast College.
Okay. All right, Dr. Shaffer and Dr. Aboulela, thank you so much for coming on RAPLINE. Appreciate it.
Thank you. Thank you for having us.
And that is a wrap for this edition of RAPLINE. Thanks again to my guests from the Avicenna Free Clinic. And RAPLINE, of course, a service of Gulf Coast State College and GC 90.7 FM. Remember, if you're thinking of adding a pet to your family, consider the adoption option. I'm Emily Balazs. Have a great day.